Hi, welcome to UK Care World. Today we will learn first part of Domiciliary Care Fundamentals. Let's start.
Hello and a very warm welcome to you. This training has been put together especially for all of our care workers and care support workers. We're going to spend a little time together looking at the core foundations of the incredible and, really vital work that you do every single day.
Now, the idea here isn't to start from scratch. Not at all. It's really about building on the fantastic skills that you already bring to your role. Think of it as sharpening our understanding of those core principles that guide you, just to make the great work you're already doing even more impactful. Okay, so let's dive right in. Our first topic is a big one: your role as a carer. We're going to get to the very heart of what it means to provide that professional and compassionate support.
And I really wanted to start with this quote because it's something we should never, ever forget. The work you do is just so much more than a job, isn't it? It's a truly vital service. You make a profound difference in people's lives. Your presence, your skills, your kindness, that can literally be the most important part of someone's day.
When you think about it, your complex role can really be broken down into these 5 key areas. Of course, there's supporting daily living, the practical things. Then there's providing that crucial emotional support, which sometimes is as simple as just listening. And at the foundation of it all is ensuring safety and well-being. But what ties everything together? Well, it's working with professionalism and, above all else, upholding the dignity and respect of every single person you support. These really are the pillars of excellent care.
Speaking of those pillars of care, that leads us perfectly into our next topic. This is really the guiding philosophy for everything you'll do: person-centered care. And it's exactly what it sounds like. It's all about putting the individual first.
So, what does person-centered care really mean when we're on the job? Well, it's actually pretty simple. It means we look past the diagnosis, past the condition, and we see the whole person. Every single individual has their own unique life story, their own likes and dislikes, their own personal wishes. Our job is to honor that and to support them in living the life they choose.
And how do we do that? We do it by following these core principles. Dignity and respect, well, those are absolutely non-negotiable, right? We always look for ways to promote independence. We offer choice, even in the smallest things. What to eat, what to wear, it all matters. And of course, we protect their privacy, and we work in partnership with them and their family. We're all a team.
Now, you can't have a true partnership with great communication. And that's our next topic. It's so important because communication is the tool we use. It's how we build the trust and the understanding that is absolutely essential for a good, strong, caring relationship.
And, communication is so much more than just the words we speak. Of course, our verbal communication needs to be clear, simple, and we should always use a calm tone of voice. But just as important, if not more important, is our nonverbal communication. Think about it. Our body language, a warm smile, making good eye contact, sometimes that can say so much more than words ever could. It shows we're present, we're listening, and that we genuinely care.
So this naturally leads to a really important question we can all ask ourselves. How can I be a better listener? It's funny, isn't it? So much of good communication isn't about talking at all, but about really hearing what someone is saying. It all starts with giving them your full, undivided attention. It means showing you understand, maybe with a nod, or by saying something like, "So what I'm hearing is..." That's active listening, and it's how we build trust and make people feel truly heard and valued. Okay, let's move on to our final core topic for today. This one is a really crucial part of your professional duty of care. It's a simple 3-part process: observe, report, and record. Getting this right is absolutely essential. It protects the people you support, and it protects you too.
So, let's start with observe. You are often the person who knows the people you support best, better than anyone sometimes. You're the one who's going to notice those small changes, a shift in their mood, a difference in their appetite, or maybe how they're moving. And those observations you make, they are so important. They can be the very first sign that something isn't quite right and that a little extra support might be needed.
Now, if you do observe something that concerns you, the next step is to report. And there's a very clear, simple procedure to follow. Number 1, stay calm and just assess what's happening. Number 2, do what you can to make sure the person is safe right there in that moment. And number 3, report your concerns immediately to your manager or supervisor. It's so important to remember that your role is to report, not to investigate.
And finally, that brings us to record. You've probably heard this saying before, and it is the golden rule in care. If it isn't written down, it didn't happen. Keeping clear, factual, and timely records is just a non-negotiable part of your job. It's what creates a professional record of the care you've provided, and it's what helps the whole team stay informed and on the same page.
Well, we have covered a lot of really important ground together. So before we finish up, let's just pull everything together and have a quick look at the key takeaways from our training today.
So, if you remember just 3 things from our time together, let it be these. First, always practice person-centered care. It truly is the heart of everything you do. Second, clear, kind communication is absolutely essential for building trust. And finally, always fulfill your professional duty to observe, report, and record. Do it accurately, and do it promptly.
And that brings us to the end. I just want to say a sincere thank you. Thank you for your time, and thank you for your dedication to this incredibly important work. Your contribution is valued more than you could possibly know. We'd be so grateful if you could take just a moment to leave any comments or feedback on this training for us below. It really does help us to improve for the future. Thank you again.
Hello, friends. Did you enjoy and learn something new today? I will see you in second part.